The respiratory system is responsible for the exchange of oxygen and carbon dioxide in our body. Air enters through the nose and then enters the pharynx. It'll go through the larynx and into the trachea. The trachea will branch into the right bronchus, which feeds air into the right lung, and the left bronchus, which will feed air into the left lung. The diaphragm is what separates the abdominal cavity from the thoracic cavity. The larynx, or voice box, is constructed of 9 cartilage. The hyoid bone is the bone to which the larynx is attached. The epiglottis is the flexible, elastic cartilage that helps cover the glottis or the opening to the trachea. The thyroid cartilage is the large cartilage that is the most prominent cartilage of the larynx, and the cricoid cartilage is then the one underneath. This membrane, the thyrocricoid membrane, is the area that you want to puncture if you do a tracheostomy. That goes in below the vocal folds. The tracheal cartilage are then below the larynx. On this model we have the hyoid bone, then the thyroid cartilage, and the cricoid cartilage. The tracheal cartilage then hold the trachea open. The Adam's apple is the prominent swelling of the thyroid cartilage. It's more prominent in men than women. And the epiglottis can just be seen above the top here. In this cutaway of the membrane, you can see the epiglottis right there. The vocal folds are what help control the air coming through the larynx and allow us to produce noise. Here is the epiglottis. When we swallow, this folds over the opening in the trachea so that we don't get food into our respiratory system. The bronchioles divide into smaller and smaller branches until we get to these terminal bronchioles that feed into the alveolar sacs. These are individual alveoli. The tracheal cartilage are C-shaped, and they hold the trachea open even during swallowing. Here is the esophagus, and when we swallow, food will go in here, but we will not allow that to bulge into the trachea and close the trachea. These are the tracheal cartilages, and that is what keeps the trachea open or patent. On the cat, the larynx is there at the top, the trachea, and then the right lung and the left lung. Here is the diaphragm. As we look at the larynx more closely, the large cartilage at the top is the thyroid cartilage, and then there is a thinner cartilage underneath that is the cricoid cartilage. Then there are very, very thin tracheal cartilages that hold the trachea open. Pulmonary ventilation consists of 2 phases: inspiration, or gases flowing into the lung, and expiration, or gases flowing out of the lung. We can look at respiratory volumes and pulmonary function tests to help evaluate how efficiently the respiratory system is operating. A spirometer is used to measure the amount of air moved under varying conditions of inspiration and expiration. Then respiratory capacities are combinations of the various volumes. This is what a spirometer looks like. As we measure respiratory volumes, the tidal volume is the air moved during normal, shallow, regular breathing. In a young, healthy adult male, it's about 500 milliliters. The inspiratory reserve volume is the air that can be inspired forcefully after a normal tidal inspiration. This is another 2 to 2.5 quarts of air. The expiratory reserve volume is the air that can be forcibly expired after a tidal expiration. This is about a quart of air, about 1,000 milliliters. And the residual volume is the air that remains in the lungs even after the most forceful expiration, about 1,200 milliliters. This is the air that keeps the alveoli open and maintains the patency of the alveoli. Respiratory capacities are various sums of the different respiratory volumes. Your vital capacity is all of the air that you can move in and out of your lungs. So that would be the expiratory reserve volume plus the inspiratory reserve volume plus the tidal volume. The total lung capacity is all of the air in your lungs. So that would be your vital capacity, expiratory reserve volume, inspiratory reserve volume, and tidal volume, plus the residual volume. The minute respiratory volume is the amount of air you move in 1 minute. So that would be your tidal volume times your respirations per minute. The forced vital capacity is the deepest breath you can take and forcefully exhale. The forced expiratory volume is the amount of air expelled during a specific time while you are doing a forced vital capacity. The forced expiratory volume is usually measured in seconds, so an FEV1 is the volume of air expired in the first second. For a normal person, that should be about 80% of the forced vital capacity. A low FEV1 is seen in people who have obstructive pulmonary diseases. The FEV2 is the volume of air that's expired in the second second. That should be about 95% of the forced vital capacity. Tidal volume, vital capacity, and expiratory reserve volume can be measured directly, but you have to calculate the IRV. You'll remember that the vital capacity was the tidal volume plus the ERV plus the IRV. If you do a little algebra, the IRV is equal to the vital capacity minus the sum of the tidal volume and the expiratory reserve volume. Gases flow into your lungs based on pressure differences. There is a slight pressure difference between the inside of the lung and the inside of the thoracic cavity. This slight negative difference is what keeps the lungs inflated. The fact that the pleural fluid is sticky and holds the two layers of the pleura together means that the lungs move with the chest cavity. As we increase the size of the chest cavity, we'll lower the pressure in the lungs. Boyle's law says that when you increase a volume, you decrease the pressure in the container. So as we contract the diaphragm and contract the intercostal muscles, we increase the size of the thoracic cavity. This means that the lungs get larger, the pressure in the lungs gets lower, and air flows in. The phrenic nerve is the nerve that controls the diaphragm. Intercostal nerves control the intercostal muscles. To exhale, we still use Boyle's law. This time, all of the muscles relax. They go back to their normal positions. That means the thoracic cavity gets smaller, the volume gets smaller, the pressure increases in the lungs, and that's going to force air out of the lungs.